I'm Dr. Megan Rohde, one of the co-owners of Revolution Wellness. And today we're going to talk about the benefits of core and hip strengthening, specifically for runners, but honestly, this benefits anybody who is active. So first, let's talk a little bit about anatomy. Your core is made up of your diaphragm on top, your pelvic floor on the bottom, your abdominal muscles in the front, and your back muscles in back. That's an oversimplification, but for the purposes of this video, it's enough to get you going. Your core functions a lot like a soda can, and so it's pressurized. That pressure helps to stabilize your spine. However, sometimes we run into pressure management problems when we take a deep breath, our abdominal muscles tighten, our back muscles tighten, and our pelvic floor might not quite be strong enough. Occasionally, we'll see that as a pressure management issue in people who have things like prolapse, stress incontinence, or other pelvic pain issues. One of the things that people neglect is engaging their core. Now, when we talk about core engagement, we're not talking about bearing down, because if we bear down, we're pushing down through that pelvic floor and we're making that pressure management problem even worse. So what I'm talking about is bringing the belly button in towards the spine while simultaneously maintaining normal breathing. If we're able to maintain normal breathing, then we're bracing in the front. The muscles in the back are going to cue up just as they should, because neurologically they have similar input. If we're breathing normally, then we're allowing pressure to escape here, and our pelvic floor ends up being either relaxed or somewhat engaged, again, because neurologically these muscles typically all fire together. So the first way that you can do that is something called a transverse abdominis contraction. Now, the way I teach this, I normally have people find these two bones on the front of their hips and then move their fingers just inside those bones. If you pull your belly button in towards your spine, you should feel those muscles pop up under your fingers, okay? If you're not feeling that in standing, let's try lying down. So lying down, I'm gonna imagine that I'm pulling my belly button down towards the bottom of the table, and I feel those muscles pop up underneath me. Now, a lot of times I see patients start to hold their breath. So what I want you to do is pull your belly button in towards your spine. My favorite cue for women, lift your vag to your forehead, and then try to maintain normal breathing. It might help you to talk while you do this, kind of like what I'm doing. If you can talk, you're breathing, okay? Now, the next progression from here to get your hips involved is to add this with a bridge. So belly button comes in nice and tight, vag to forehead. We're gonna push through our feet. And if you notice my hips, as I start to push through my feet, my hips already start to rise up. I'm gonna maintain that position and squeeze my butt cheeks. Again, still breathing, still engaged. Hold for a count of maybe 3 to 5 and back down. If you wanna make this harder, you can take one leg out and do a single leg bridge and then back down. Those 3 exercises, so bringing the belly button in towards the spine, engaging the pelvic floor by bringing your vag up to your forehead, and then doing a little bridge, helps to turn all of those muscles on. Sometimes if we do those exercises right before activity, just the act of turning a muscle on can help it to be more active and engaged while we're doing the thing that we want to do. So for those of you who are runners, add this into your warm-up routine and see how things go. Thanks for watching.